Good morning, good afternoon, and good evening to everyone who's joining us today from all over the world. It is my great pleasure to welcome you to the Health and Society panel of the China Gulf Forum 2021. We are very grateful to the support of our amazing speakers today, who are willing to share their time with us. The panel will be in the format of moderated discussion, with the question and answer session in the end. You can send your questions anonymously to the Q&A box, and our moderator will go over them one by one during the Q&A section. The panel will be 75 minutes long. This panel will discuss the impact of COVID-19 pandemic responses on China and the Gulf, and the future trends of our health systems. Please allow me to first introduce our panelists and our moderator for today. Our first panelist is Dr. Nawal Al-Kaabi. Dr. Nawal Al-Kaabi is the Chief Medical Officer in Sheikh Khalifa Medical City since 2017, and the Chair of the SEHA Infection Control Committee since 2012. Dr. Al-Kaabi is a member of the International Patient Care Committee, DOH, since 2007, and the Chair of the committee since 2017. She became the Chairwoman of the National COVID-19 Clinical Management Committee in 2020, conducting the world's first phase 3 clinical trial to evaluate the safety and protective efficacy of inactivated SARS-CoV-2 vaccines. Our second panelist is Dr. Jonathan Fulton. Dr. Jonathan Fulton is an assistant professor of political science in the College of Humanities and Social Sciences at Zayed University in Abu Dhabi, and a senior non-resident fellow at the Atlantic Council. He has written widely on China-Middle East relations for both academic and popular publications. His books include China's relations with the Gulf monarchies, External Power and the Gulf monarchies, and Regions in the Belt and Road Initiative. Our third panelist is Dr. Michal Grivna. Dr. Michal Grivna is a public health physician. Currently, he is director of the Institute of Public Health at the College of Medicine and Health Sciences at UAE University. He has an MD and PhD from Charles University and a Master of Public Health from Virginia Commonwealth University. He is a Fellow of Public Health of the Royal Colleges of Physicians of the UK. Dr. Grivna is a leading expert in injury control and safety promotion. He played a leading role in the European Child Safety Alliance activities and implementing the WHO Safety Community Program. And as our moderator, Dr. Raghib Ali is the director and principal investigator of the Public Health Research Center and associate research professor at NYU Abu Dhabi. He is also adjunct associate professor in public health and population health at NYU. Additionally, he is a senior clinical research associate at the MRC Epidemiology Unit at the University of Cambridge, and an honorary consultant in acute medicine at the Oxford University Hospitals NHS Trust. And with that, I will give the floor to Dr. Ali to kickstart the conversation.
Thank you very much. Thank you to our hosts, and thank you to our panelists, our distinguished speakers today, and all of you who are joining us from China, from the Gulf, from the US, and from all over the world. I think we're very lucky to have these three experts with us today, and I'm looking forward to the discussion. So we're going to start with a general question for all of our panelists, really. And I'll maybe start with Dr. Nawal, and then probably hand over to Dr. Michal and then Dr. Fulton. So the first question, which I'd ask you all to give your brief response to, particularly for our audience in Asia, in China, but also in other countries who might not be as familiar with the current state of the pandemic in the UAE. So as I said, I'll start with Dr. Nawal. Maybe you could just tell us a bit, where do you think we are now, and where do you think the trend is going in the coming 2 to 3 months, where we're the direction of travel?
much, and thank you for the invitation, and I'm honored to be with you. So in terms of numbers in UAE, currently the number of new cases decreased to 1,931. It reached actually at the peak in February to almost 5,000. In terms of total cases so far that have been reported in the country, 481,937, and the total death is 1,500. In terms of daily tests in UAE, as you know, we do massive testing. So the daily test is around 232,000, more than 232,000 per day, which is around 2,354 per 100K population. And the positivity rate right now is around 0.9%. The daily death UAE, although we have relatively considered large number of cases in the region, however, most of the cases are mild, and this is due to massive testing that's being done all the time, and it is a requirement to test everyone at work or if you will cross between the Emirates and Abu Dhabi. So our fatality rate, case fatality rate remain low around 0.2%. And in terms of wave, I think we are now with in terms of vaccination, we've vaccinated a large number. It is around 8 million doses being distributed. Almost more than half of the population are vaccinated, and we are expecting that the number will decrease further. However, you know, Dr. Ali, that we are an open economy and also tourism are open. So I don't think we'll be able to go to zero unless the pandemic ends. Thank you.
Thank you very much, Dr. Nawal. So we may come back to the issue of zero COVID for one of the future questions, but for now, maybe I could ask Professor Michael Grivna to give his comment on that first question, please.
Thank you so much, first of all, for the invitation. I'm very pleased to be among this panel, and I think it could be very interesting discussion today. To add only to Dr. Nawal, so before what she was mentioning, I think that we are very lucky in the UAE, and we are lucky because there was like very fast and very efficient response of the government in the beginning of the pandemic, and I think this was really very effort which we really all, I think, we need to appreciate. By the vaccination, of course, the UAE is, I think, third fastest vaccination rate per capita in the world after Gibraltar and I think in Israel. So I think the vaccination is going very smoothly. All the trend which we will see, I think, will depend on the lockdown measures, how it will be still, going on vaccination rate. And I think this we see already in the somehow waves, like third waves, which was connected to mostly a little bit releasing the lockdown. And I think this was like really why we did see some spike in the February in the year, because there was some opening of the schools, and I think this was immediate effect also on the cases in the country. We need to also think that UAE is not really, as Dr. Nawal already was mentioning, that we are not isolated, that we are in the global world, and I think it is very important to understand that how the vaccination rate will be speeding in the other countries will be also influencing us, because there is travel, there is business, there is everything. So I think this is very important to think about the future. Another issue, I think, it is related to the vaccine. And there is some very important issue. It is vaccine hesitancy. And I think it is really quite growing, especially with some sort of media information connected to some reactions, adverse reaction. And I think here also government is or needs to play very important active role into fighting this vaccine hesitancy. So not to slow down in vaccination. So I think it's a very important issue too.
Thank you, Michael. Professor Jonathan Fulton, would you like to add any comments just to this kind of introductory question?
No, I think they've covered it quite well. And I would agree that we're pretty fortunate to be based here during the pandemic. It's been a pretty manageable affair. You know, I've been in Abu Dhabi for more than 400 days at this point, but I've had friends visiting from different countries with proper social distancing and proper precautions. It's actually been quite a safe and you know, easily manageable situation, I found.
Great, thank you. I mean, just to add my own brief reflections. I mean, I've been advising both the kind of Abu Dhabi and UAE Department of Health, as well as the UK government, on aspects of the COVID response. And I think, as the speakers have mentioned, you know, it really is a credit to the UAE and Abu Dhabi governments as to how they've managed the pandemic to date. And I think we can be optimistic about, you know, the trends and the future course of the pandemic, even allowing for the fact that we are an open economy. So all things are going in the right direction now, which is great. And I think, to address Michael's point, I mean, I think vaccine hesitancy is an issue, of course, but the big advantage we have in the UAE is that it's likely that a vaccine will be required for travel, and most people have to travel. So I think that will really improve the rates going forward. Okay, so
can I react to this comment? I think it's very interesting that, you know, still it is quite challenging. You know, we did some very interesting small study among the medical students related to the knowledge about the vaccines and hesitancy, in fact. And it was really quite you know, important issue. And I think there is still a lot of, you know, misconceptions and misunderstanding related to the vaccines, individual vaccines. Of course, we cannot be expert on the different you know, type of vaccines, but I think for the country, every country, it is incredibly important issue to communicate, you know, with the population that, you know, vaccination is incredibly important, and even you know, if there are some like side effects, still it is almost 100% efficient for to prevent deaths and severe outcomes. So I think it's really very important issue.
Thank you, Michael. So the next question, and I'll come back to Dr. Nawal. She has really been at the forefront of the vaccine and clinical efforts in relation to COVID, and we should really thank her for her leadership in this issue. And I've been working in the UAE for about 10 years now, and I think COVID has really shown what the UAE can do in relation to research. I mean, to recruit 35,000 people into a clinical trial for the Sinopharm vaccine was a remarkable achievement. So thank you, Dr. Nawal, for your leadership on that. The question is, obviously you were the principal investigator, or are the principal investigator for the trial. It was the first trial for this kind of vaccine in the world. Could you tell us a bit about your experience in leading this global effort and some of the challenges and difficulties that you faced?
Sure. Thank you, Dr. Raghib, for this question. So first of all, I would like to say that how grateful I am to have been the principal investigator for phase 3. I am really thankful to our authorities, Sinopharm and Group 42, for giving me this opportunity. And this was the first phase 3 inactivated vaccine to be initiated. It was as if we could see the light at the end of the dark tunnel. So it was our hope of finding our life again, and for ending the pandemic, and for contributing to the local, to the global efforts in fighting this pandemic. When it comes to challenges, as you know, Dr. Raghib, it was a dream for us to conduct a clinical trial in UAE. So this was the first large clinical trial to take place in UAE. And when we started, we were not certain that people were going to volunteer. However, within 24 hours of the announcement, as you know, initially 13 people volunteered, and 2 people actually was high profile. They are the leaders in the healthcare, Sheikh Abdullah and Dr. Jamal Al-Kaabi. And I think this sent a message of reassurance. However, I couldn't believe the number of the residents who stepped forward and was willing to volunteer. And because of that, that led us to the next challenge, which is the place. Initially, we were planning to conduct a trial in the clinical sites. However, with this number, thousands of people was willing to volunteer within 24 hours. So we therefore decided to reallocate the trial site to ADNIC, which for those who doesn't know ADNIC is an exhibition site. And at that time was used as a field hospital and discharged the last patient, because we started in the summer and the number of cases was very small. So in a matter of days, the ADNIC was converted to one of the largest clinical trial sites. Another challenge that we faced was the power, because to be able to do proper evaluation for thousands of people, we need large number of manpower. And Saha assisted us in assigning, Saha and DOH assisted us in assigning physicians and nurses from external sources and also from the field hospitals. They have good experience in the field hospitals. And at that time, we were closing the field hospitals and we used the physician and nurses. So that took us to another challenge, which is competency in clinical trials. So in order to resolve this problem, we managed to train everyone in a short time on good clinical practice, and all of them got certified. So the challenges that we faced. Of course, we managed to recruit 125 nationalities. And we have people from different nationalities stepping up and willing to participate. More than 30% of our volunteers was from UAE.
Great, thank you for that unique insight really into the success of the trial. And when I first came to the UAE 10 years ago, one of the main things I was hoping to achieve was to build capacity for clinical trials. This was my background when I was at Oxford, and I was really been delighted to see the progress and success over the last year. Maybe moving now to Michael, Professor Michael Grivna. So just we'll stay on the vaccine and more medical issues for the moment. So many people understandably are worried about new variants emerging, and there's been a lot of publicity about Brazilian variants and South African variants and British variants. Could you tell us a bit about how we can deal with that in relation to both vaccinations and strategies for dealing with that?
I think it is very important issue, especially in so many, transmissions and so many people affected by the virus. I think it could be expected that the virus would mutate in so many, hosts, and this mutation, it could be expected. Now, the question is really how it is related to the, for example, the severity of transmissibility, and it depends, of course, how where it is in, in genetic material, where is the change located. So if it is very, shift, which will be quite serious, then it is, of course, some consequences could be serious. Of course, by the now, at least by the World Health Organization, there is some reassurance that, like all the current vaccines, they have at least provided at least some protection against the new virus variants. The WHO, of course, is monitoring situation, and they established two task forces. One of the, following the genomic and genetic mutations and collecting the information from different countries. So it is first, and the second, of course, it is the, if it will be needed some changes in the vaccine development or the structure. So that means if there will be need to develop or to change the vaccines, that it will be more efficient to the new variants. Until now, the situation it is that they're expecting that the new or the vaccines are also protected against even the new variants. So I think it is really still, but vigilance is very important in this issue.
Great, thank you, Michael. I mean, just to add to that, of course, the virus does mutate, but vaccines, particularly the newer technology vaccines, the mRNA vaccines, can be adapted very quickly within a matter of weeks to deal with these new variants. So that's a big advance compared to other vaccines. And I think most of us are familiar with influenza vaccines for flu, vaccines for flu, which do have to be adapted every year for the same reason. So I'm personally optimistic that although these variants will inevitably occur, that we will be able to deal with them. And we'll come back to the Sinopharm vaccine maybe a bit later in the discussion in relation to that. One other point on that, of course, is the way that both Abu Dhabi and now, for example, the UK have fairly strict border controls and quarantine requirements, because to avoid the situation where you do have a new variant which escapes from the current vaccines. So again, that's one of the strategies that well, many countries have used, and the UK has been relatively late to that. Abu Dhabi has had it from the beginning, really.
Maybe one, Raghib, if I may add, the very important issue with the vaccines, even if it is like the new variant that is, preventing severe consequences or death. Even if somebody will get, the virus, even the changed virus, but if it will be only mild, so it is not so big problem. So, and I think this is like reassurance, at least by the, the vaccines what we have, that are really, all of them, they're almost 100% efficient for the severe and the death related. So I think this is really very assuring. And I think the countries, they need to vaccinate as fast as possible to limit the spread and to, in fact, to decrease the population where virus is somehow transmitting.
Thank you, Michael. We're going to move on to slightly more public health, political kind of issues related to COVID. Just before that, Dr. Nawal, do you want to add anything on the vaccination or variants point?
I'd just like to let you know that we are monitoring the mutations and the variants of concerns as identified by WHO. In Abu Dhabi here, we are doing gene sequence in Khalifa University in the surveillance lab in KMC, and the largest number are done in group 42, where they can process thousands of viruses. So we are monitoring those variants very closely.
Great, thank you. So we're going to change tack a little bit for the next kind of 3 questions, which again relate more to, as I said, to policy. So maybe I'll ask Professor Jonathan Fulton to comment on this first question first. So as we know, different countries have dealt with the pandemic in different ways, ranging from the approach, for example, of New Zealand or even China compared to places like Brazil and to an extent different states in the US. So how would you, I mean, you can feel free to comment more broadly on this, but how do you think the different countries' responses have been effective, and also how they reflect different healthcare systems and the challenges of dealing with COVID in different regions? So both from the healthcare system, but also more broadly.
Well, it's very interesting, and I from my perspective, I look at this from an international relations disciplinary approach. So I'm looking mostly at the geopolitical consequences rather than the public health policy. So in terms of the geopolitical aspects of it, I find it very fascinating, especially here in the Gulf, because what we've seen is this transition when it broke in Wuhan back last, I guess, in December 2019. The way we looked at it was China was kind of the victim of the situation, and a lot of aid was flowing from the Gulf, and countries in the Gulf were lending support, material, rhetorical, moral support to China. As it started to spread, we saw a change. We saw China seem to get a grip on it relatively quickly. And then as it spread first in Iran quite dramatically, and then through the rest of the Gulf, we saw that kind of transition where China actually reversed roles and started to play a bigger role in sending PPE and lending experiential support, talking with public health officials, explaining what they've been through with tracing and treating. Excuse me. And it's been very interesting as somebody who looks at the international relations of the Gulf very closely, because typically Gulf countries in this type of a situation would be looking at the UK or the US for leadership. And of course, we all know that the US and the UK have not been especially considered models in their political response to COVID. So it's been very interesting to see China making quite substantial gains. And for a country that until now has been seen largely as an economic actor to suddenly play a bigger role in issues of governance, of public health policy, AI. This has been a big thing. Dr. Kaabi mentioned G42. G42 has been working very closely with a Chinese firm based in Shenzhen, BGI, which is an AI company. So there's been a lot of really interesting geopolitical trends that have come of this. And I think it's really reshaping the political landscape of the region, leaving a lot of room for other extra-regional powers to play a much larger role.
Great, thank you. Maybe we'll come back to some aspects of international relations shortly. And just on the public health and health systems, Professor Michael, would you like to comment on the response of different countries?
Yeah, I think what we just heard, and I think it is like China has, in my opinion, very good public health system. So the response was really very swift and prompt in the Wuhan. So I think that they reacted very fast, and so they at least gave the chance to other countries to prepare. You know, I think if they will not be so strict, it will be even like we will have, you know, much bigger challenges in Europe or Middle East. I think this was really very positive. For the UAE government, I think it was impressive how fast it reacted. If we think, you know, our first case here in the UAE was 29th of January. And immediately UAE started to really implement the measures. And I think it was really excellent. They were like really, you know, doing many things, like, for example, healthcare system readiness, prepared testing facilities or field hospitals. Even the wave was only starting, but the UAE reacted very fast. Then another issue in the UAE, I think in the healthcare system, it is quite challenging that we have the federal level and then national levels and the different authorities. But in UAE, there was decision to centralize this, you know, the reaction and to centralize leadership. They established this National Crisis and Emergency Management Authority. And I think it was very important, you know, again, the aspect of the you know, the success. Communication, unified communication was also incredibly important. You know, that how to get the messages to the population, implement the new technology, mobile applications, and so on. This was really incredibly fast. I was like really very impressed. The national level, I think also very useful was to establishing what you were a member of. It was this research committee for COVID-19. And I think this was very important for the monitoring of the situation, to bring the, you know, to translate knowledge from the research to the action in some way more planned manner and so on. So I think it was very, very important. And then another, maybe this effective collaboration between stakeholders, you know, how to transfer and retrain, for example, healthcare personnel, like for example, school nurses, to the, you know, contact tracing, or you know, on the centers to different healthcare facilities. I think it was incredibly important, you know, lessons what we learned here.
Thank you. Dr. Nawal, would you like to add anything?
Sure. So here in UAE, we identified the first COVID, the first one in the region. And actually, our leadership instructed us early on to expand, to put whatever we need to expand the capacity for testing. At that time, like in February, March, we have really few numbers, and we've been given a green light to prepare isolation hospitals, to start to think about field hospitals. We learned a lot from China in terms they are isolating everyone. And that's what we did at the beginning of the pandemic. We didn't let anyone to stay out in the community, everyone isolated. So, and the other things in UAE, actually all the sectors work together. And we, the government and the private hospitals work together, and the hotels. So we use the hotels for isolation. We use the manpower in the government to support, in the private to support us in the government. We managed to expand the intensive care in a very short period of time. So honestly, like as a physician, I never thought that I will not be able to admit someone who's very sick. We admit anyone who's sick. Actually, initially we admitted even everyone who's positive and then was mostly moderate and sick patients, but we never have a problem in terms of bed availability or test availability or even manpower. We worked with the private, and we managed to get what we really need. Of course, we end up changing our way of working. In pandemic, it's different, but it was a great experience. And as you know, in the Deep Knowledge Group released their evaluation of 25 top leading cities, and Abu Dhabi was at the top based on 50 parameters across 5 categories that include healthcare, economy, many others, government, many things. So they really, I think they managed it really, really well. And that go to the leadership, because Sheikh Mohammed, you remember he said, don't worry, la tshillun ham. And he really meant it in terms of for everyone. No worries about the healthcare. You don't worry about the nutrition. You don't worry about your economy. You don't worry about your employment. So it was really managed very, very well.
Thank you. Yes, no, of course, I would agree with that. And as we have seen, even in highly developed countries in Europe and other parts of the world, just having a good healthcare system and wealth is not enough. We have seen hospitals in a number of European countries not being able to cope with the number of patients. So good leadership and management, of course, it has been crucial. Okay, we're about halfway through what we had planned for our moderator discussion, and I would encourage participants, audience members to submit their questions as well. There will be time to go through those after about 15 to 20 minutes. So please do submit your questions through the Q&A box that you have in front of you. I'm going to come back to Professor Fulton now, actually. So apart from healthcare, what are some of the kind of other social and political challenges for the Gulf countries because of the pandemic, would you say?
Well, obviously the economic consequences are going to be pretty substantial. What we see is a lot of countries here in the Gulf have been looking to diversify their economies beyond this post single resource rentier model. And again, this is another area where we see the China factor come in quite heavily, because what we see, a lot of these Gulf countries have been embarking on these vision programs, the Saudi Vision 2030, or the new Kuwait 2035, or Oman Vision 2040. Mostly what these are just an attempt to create these more sustainable economies. And so COVID has hit everybody quite hard. I mean, even before COVID came, we saw in Dubai quite a lot of economic pressure. In Oman, especially in Bahrain, they've been under severe pressure to diversify their economies. So it's been pretty interesting to watch, because China has stepped in quite a big way. They've got this initiative, the Belt and Road Initiative, which has been playing a big role in their foreign policy. And this lines up quite neatly with a lot of what the Gulf countries are trying to do in terms of redesigning their economies. And this has been really just to watch, again, to go back to the AI component. China released this Arab policy paper in 2016, and part of it was talking about how digital cooperation was going to feature a lot in and in cooperating with Gulf countries. And that involved things like fintech and AI and satellite systems, satellite navigation, smart city creation, 5G networks. And so you've seen, especially in Dubai, but also in Abu Dhabi and in Riyadh and Neom, a lot of Gulf cities are really cooperating a lot more with China on this stuff. So I think the economic consequences, of course, are what we're all looking at. How quickly can everybody get back to whatever a new normal will look like? Is it going to involve more automation? Is it going to be more jobs? Which companies or countries are going to be supporting the Gulf in this? But again, just as somebody who's watching China's involvement with the Gulf countries, I think it's been very fascinating to watch how China's really kind of stepped up to the moment in developing much stronger, more diverse relations with the Gulf countries in this crisis.
Thank you. So I think on this, obviously this is a China Gulf Forum, so I'm just going to ask a couple of questions related to the relationship between the UAE and China in relation to COVID. So this question maybe for Dr. Nawal first. In terms of the decision-making with regard to both which vaccines we used in the clinical trial and now in clinical use, So how has that decision making been done, and how important has the role of China been in that decision making process?
Okay, so here in UAE, we have a very strict process in terms of what vaccine will be approved. So if we start with Sinopharm, the reason that Sinopharm was approved even before China, because the study was conducted in UAE and the largest number of volunteers was in UAE, and we've seen the result ourselves, like even before any publication. And we are monitoring those volunteers ourselves. So we do have this data, and that's one of the reasons that the government decided to issue the emergency authorization and start to vaccinate the frontliners initially. And then we did the full registration and vaccinate most of the population. Now there are other vaccines. Sputnik, again, we did part of phase 3 in Abu Dhabi, and it was registered for emergency authorization, and any of the resident like to take it, it is available. Then we have Pfizer and AstraZeneca also registered, and so we have different options. And again, all those vaccines, the data was reviewed by the National Federal Committee, and the decision made at the federal level. And I think it is an advantage to have different type of vaccines within the same country.
Yes, no, of course. And the different vaccines, although as Professor Grivna mentioned, they've all been shown to be particularly equally effective against serious cases, so hospitalization, intensive care, and death. It's good to have different options available for the population. So that's, the UAE has again done very well in having those options for its people. There's a related question actually from the chat, which I think I'm going to take now because it's very much related to this area. So the question says, can the panelists comment on vaccine diplomacy, diplomatic considerations of vaccine donation and export schemes that different countries are taking, i.e. China, Russia, India, US, UK to an extent? How does the vaccine collaboration, especially the China-UAE joint trials, add to this picture? So who would like to take that one first?
Maybe I can only, or go ahead, Jonathan. Maybe.
Okay.
Go ahead. I can comment after. Yeah.
Well, just in terms of within the larger, again, the geopolitical trends, what we've seen, of course, with the U.S. election that took place in the transition from the Trump to the Biden administration, and under President Trump, the U.S. didn't seem to really have a strategy for itself, let alone for its partners or allies. And this has created, again, a big opening for countries like Russia, which really is to me quite interesting. Nobody, again, as somebody who has no background in public health, but follows international politics very carefully, the idea of Russia stepping up as a leader and supplying vaccines, a lot of us, of course, just kind of rolled our eyes and thought, Russia, really? With China, this wasn't surprising to me because I've seen China has built a lot of this into its regional strategies, and it's really made gains, again, through this Belt and Road Initiative, to include things like kind of the less political aspects of relationship building, things like health cooperation, media cooperation, digital technology cooperation, soft power projection, things like this. So obviously, in the bigger picture, China's been working towards this for quite a while, and they've laid a pretty good foundation, and they were able to capitalize on it. And we saw just what was it now, about 10 days ago, when the foreign minister Wang Yi came to Abu Dhabi and announced that the UAE would be the site of this manufacturing distribution site for Sinopharm. And this is really, I think it shows again this depth of political coordination between the two countries, because both see themselves, the UAE as a regional leader, reaching out to a lot of countries in the Middle East and Africa. And China, of course, wants to present itself as more of a responsible great power beyond regions, just globally. So it seemed to be a place where the two countries were able to line up their vaccine diplomacies quite well. And I think this is also interesting just because, again, before Wang Yi came here, he was in Iran. And a lot of folks were looking at this Iran visit and getting very spooked, I would say, about the depth of collaboration. And what you see is China and Iran have very little to build on, whereas China and the UAE have been working very closely for several years now on a wide range of things. So it's a very deep and multifaceted relationship. And I think, again, the vaccine diplomacy is a reflection of this.
Thank you. Michael, would you like to add to that?
Yeah, I think maybe a little bit like towards Russia, there was some comment. I think that many times the issue with vaccine is politicized, and Russia is really quite a big experience and long experience in the vaccine development and research capacities. And already from the communist regime, they had really this public health approach. In fact, it was model which was also in China. So they had like really capacity to develop very fast and to do the vaccines. Unfortunately, this Sputnik is very often politicized, and I think it is a little bit like challenge. I think any issue related to the infectious disease, especially in this critical situation, should be dealt without this political, connotation, and to help as soon as possible to get the vaccines to the different countries. I think we see huge challenges in the Europe between the different countries, how it is like, and differences between UK and European Commission, how they handle the issue. And now many of the European countries are in the big trouble, in fact, with a slow vaccination rate. Because it was centralized, and now the different countries are trying even to do the individual negotiations with the company to somehow increase the vaccination rate. I know that I'm following the situation in the Czech Republic. Czech Republic was in the first wave very active, and they had very good management of the pandemic in the beginning. And suddenly, because the political issues and so on, and of course with the slow vaccination rate, they are now like overwhelmed with the number of the cases, severe cases, ICU units, and deaths in the Central Europe. So I think that here we need to remember that we will not be safe until everybody is safe. So I think that this international or global view is incredibly important. And I think we should really support all these activities on the international level, like, for example, World Health Organization COVAX program, how to get the vaccines as soon as possible to those who are in need, because we do see huge inequalities in the world, and even like to the access to the vaccine distribution, in the economic power to buy the vaccines and so on. So I think we need to understand that this issue, we should not be selfish that, okay, so for example, in UAE, we are very lucky. The vaccination is going very fast, and almost, we are reaching the so-called herd immunity. But we need to think also about our neighbors and about the worldwide, because I think it's very important. So in my opinion, I think even the Russian vaccines, to help them, if it is like to go through the trial or emergency approval or whatever, it is important because it would increase the capacity to vaccinate more people. I think we see now in India, for example, that they are really producing, even like quite big producers in India, but still vaccination rate is, we think it is quite fast. They are vaccinating now 1 million, I think, people per day, but still it is, if you will, think how big it is country, it is really not so big. And I think even like for us in Middle East, or in the UAE, we are so close to these countries around that we need to think, about the more in the global picture, that we need to, to support any possible fast vaccination. So I think it's very important.
No, thank you. Maybe I'll ask a related question to Dr. Nawal. And we've had a couple of questions on the plans for, particularly in relation to the vaccines that are being manufactured now, the Sinopharm vaccine in the UAE. What are the plans both for the UAE for that vaccine, for the region? Will they be adapted to deal with new variants that we were discussing earlier? So really, what are the next steps in relation to the UAE's leadership on vaccine production now?
Sorry, so for now, the agreement is to manufacture the inactivated vaccine. Of course, if there is any changes within the vaccine to accommodate the new strains, I'm sure the Group 42 will work with Sinopharm on that. However, I must remind everyone that inactivated vaccine, they are using a whole virus. They are not using part of the virus. So when you are using a whole virus, the resistance is less than if you are using just part of the virus. And we are monitoring continuously because we are doing the gene sequence. We are also monitoring the response of the vaccine to those variants. And of course, if there is any major changes, I think all the vaccine need to change and improve their vaccination. And I do believe that COVID here to stay. It will not go anywhere. Probably we will be able, inshallah, to control the pandemic globally, but the virus itself will stay, and we have to continuously to look for a good vaccine that will cover different variants.
Thank you. And are there plans in terms of the manufacturing capacity of the UAE? Is that to provide vaccines to the region, to the world, just to the UAE?
Actually, I don't have the details, but I know it will not be only for UAE. It will be for larger than the region, I will say. Not only the Middle East, outside the Middle East.
And of course, the UAE has really been one of the global leaders in ensuring that there is vaccine supply to developing countries and low-income countries through various initiatives, which people may be familiar with. So that's an important kind of point to make, as well. As Professor Michael said, we need to focus on vaccinating the whole world. Just a final point maybe from Jonathan. So you've answered this partly already, but overall, because of COVID and because of what we've been discussing, do you feel that the crisis has brought China closer to the Gulf, and do you think that will continue going forward?
Yeah, no question. Again, I think, as I said, for decades now, most folks in the region have looked west towards the UK or to the US on political or security issues. And what we've seen this century is that China's developed a much bigger economic presence. And a lot of folks dismiss it as purely an economic actor. But in 2013, again, with this Belt and Road Initiative, this signaled a much more ambitious political position for China across Eurasia and the Indian Ocean region primarily, but increasingly beyond. I think when you look at the Eurasian landmass, obviously you're not getting from China's biggest trading partner in the EU without a stable Middle East. So China's been working with a lot of countries in the region that it sees as those countries that cooperating with contributes to a more stable status quo. And again, that's why I think you see the UAE as really the load-bearing pillar of China's Middle East policy. Again, a lot of folks look at Iran and tend to exaggerate the depth of China-Iran relations. It's very, very, very minimal economically, strategically, politically. China does very little with Iran. But when you look at the Emirates, it's a very diverse relationship, not just on, Saudi is the biggest trade partner for China in the Middle East, but this is very, very much dominated by energy. Whereas you look at the UAE, it's the unusual Middle East country that has a trade imbalance with China that favors China. Typically, China buys a lot of energy and sells a lot of manufactured goods, and that tends to benefit countries like Saudi. But in this case, because of the UAE's more diversified economy, it actually makes itself a much better economic partner for China. So it's been playing a pretty interesting role here. Again, the strategic implications of this are that China wants to work with countries that can support Middle East stability. When you see things like the Abraham Accords or the UAE's more muscular foreign policy in recent years, you see that it really lines up quite interestingly. And just to comment on what Dr. Nawal was saying about the UAE's leadership and beyond the region in vaccine distribution or supply, this is something very interesting. Like you, Dr. Ali, I've lived here for quite a while. I came to Abu Dhabi in 2006. And at that time, the UAE's foreign policy was actually quite modest. It tended to be a kind of self-perception of a small country. That's changed in recent years. The UAE's actually been stepping up regionally. I think part of this is because of the fallout of the Arab uprisings, where stability across the region has been a precious commodity that few countries are able to contribute to. And the UAE has actually been I think, playing a much bigger role in this. So that's why you see countries like China, India, Russia, Japan, Korea, playing a bigger role in working with the UAE. So for China, absolutely, in terms of its Belt and Road ambitions, in terms of its COVID diplomacy, in terms of what it has to contribute in terms of digital diversification. And also, we all know that American politicians aren't going to get elected by saying, let's send more troops to the Middle East. The US has been saying for a very long time that it wants a less deep footprint in the region. So I think a lot of leaders here are looking to a post-American period where I don't think China is the answer, but a more diverse set of great power partnerships certainly is. And China seems to be the country that has, I'd say, the most positive role or vision for what it hopes to achieve in the region. So yeah, I think what we've seen in the past year has been China's made a lot of gains in the region and with the UAE.
Thank you, Jonathan. So I can see there are some questions which are quite specific to kind of travel and rules in the UAE. If we have time, we'll come back to. But just for the kind of next 10 minutes, I want to focus a bit more on broader public health issues. So, of course, inevitably, much of the focus over the last year has been on COVID. And that's a question I'd ask Professor Michal to answer first. In terms of trends in other aspects of population health or public health, what has been the impact, particularly of lockdown as well as COVID and other restrictions on our mental and physical health and well-being in general, would you say?
It is a question to me, sorry, Raghib. Yeah, okay. I think, by quite famous article from the Freudenberg, he was mentioning that there are 6 pillars of day-to-day life, right? And it was like food, transportation, education, work, social connection, and healthcare. And if you will think about all these 6 pillars, all were affected by the COVID. So of course, there are like growing number of the evidence how it is influencing different aspects of the daily life, but it will need a little bit even longer time to properly evaluate and assess, right? So now, if you will think about mental health, there was a quite interesting systematic review which was published recently and showing that the impact for the mental health is immense. It is almost like 30% of the people, they have some psychological challenges, and it is like anxiety, depression, insomnia. They were comparing also the healthcare workers with the other population. They found that it is really quite very similar, even of those people who are in the the first healthcare workforce comparing to the other population. So it is really incredibly challenging issue. So there are of course issues related to the other, like for example, spending a lot of time in the household, increasing the possibility for the family violence. So there are many reports growing about family violence, child abuse, and some other violence related in the families. Now, related to the other aspects, of course, it is to the in connection to the healthcare system. So access to the healthcare system was limited in some way. For both those people, especially with the chronic diseases, they were trying to avoid to going to the doctors because they were worried that they will get the virus. In this case, again, in the UAE, we were quite lucky that the healthcare system started to rearrange a little bit system of delivery of the healthcare, like using more telemedicine, for example, or the delivery of the pharmacological products to the home. So it was really very important. Now, if you will think, it is mental health issues, but then limitation for the physical activity. So the people were locked down in the home, so it was very challenging for them to go to the gyms, what, for example, they were using before. The nutrition was another issue, right? So it is all these risk factors were really somehow affected. So I think it's really, but the proper assessment still needs some time to see more, more influence on the population health. Related to the environmental health issues, there are quite interesting studies how the lockdown was affecting, for example, air pollution related to the traffic or to the factories, how it was like really, in fact, it has positive impact on the environmental health. But still, I think that we need to wait a little bit more on the more proper studies to assess all the effects of the COVID and on the population health.
Thank you, Michael. And this has been a big discussion in the UK as well as many other countries as to how do you balance the health harms of COVID versus those of lockdown and restrictions. And it's a very difficult answer because the evidence base by its nature is going to be very limited. And many of the immediate health harms from COVID are of course very apparent, whereas the health harms from lockdown may only be seen in years or decades to come, particularly those that result from economic impacts. So it's a very tricky balancing act, and of course that's why governments have struggled all over the world to really deal with that. But I think it's fair to say those countries, sorry, just
May I
those
add
countries.
something, Dr. Raghib?
Of course, please go ahead.
Yes. So here in Abu Dhabi, what they did, and I think it was very useful, they have, we have here, they announced to the public a dedicated hospital for COVID and free of COVID. I know it is extremely difficult to say free of COVID, but here what they do is anyone need admission or need a procedure, they do testing. And of course, if they are positive, they transfer them to the COVID hospital. And this actually reassured the public, instead of sitting at home with chest pain, they know that there are non-COVID hospital and they tend to call the ambulance. But initially during the pandemic, people were extremely reluctant to go to the hospitals.
Yes, that's a very important point. I mean, I worked on the front line myself during COVID in the UK, and we had that problem that many of our usual patients in internal medicine, emergency medicine, etc., were not coming to the hospital. And sadly, many people suffered and died because of that. So the UAE and Abu Dhabi, you know, they had a very sensible strategy right from the beginning to try to separate these two things, which is difficult in many countries, but that was, of course, the right strategy. Michael, did you want to come back to say something?
No, I think it was covered. I think it is again very important social issue, and this like showing the inequalities even to the healthcare or to the challenges. So it was the COVID pandemic even increased these inequalities, and I think this is very important to mention, because you know even like the workers who are unemployed and suddenly they are locked down in the country, they could not travel and they have limited access to the healthcare. So we need to think also about, you know, different aspect of the, or different part of the population in the different countries, that it show even like bigger, you know, impact on these inequalities.
Yes, no, that's a good point.
Any issues.
It has generally exacerbated inequalities in most countries, particularly where healthcare maybe is not available to all. So we have a few minutes left, and we have half an hour left, but I know it may be difficult for people to stay that long. So we've got a couple of questions left I wanted to ask, and then maybe some from the audience as well. The next question was, I mean, you mentioned some of this already, actually, Michael, in relation to healthcare and using new technologies and telemedicine. It's not something we use in the emergency department, of course, generally, but in other areas of healthcare, it has become very prominent. So maybe Dr. Nawal, of course, you're the Chief Medical Officer for SKMC. You would like to comment on the use of telemedicine and new technologies in the UAE?
Yes, so telemedicine was extremely useful during the pandemic. At least we can follow up our patient who had chronic illness, and we do deliver the medication to them, because unfortunately with the especially with wave 1, they missed their medications. Of course, there are things that you need the patient to come to the hospital. For example, diabetic, you can't follow certain things through consultation, but still the patient need to come and do certain testing. However, I think with artificial intelligence, we can do more. Like someone with diabetic, if they can upload their results to the system and then we can see it, we will help them. I think we managed to use a lot of teleconsultation during this pandemic. And I think it's extremely useful, especially for follow-up, to tell the patient certain results rather than bringing them to the hospital. Mainly when we need to bring them to the clinics, it's for physical examination. But everything else, I think it can be done either through teleconsultation or drive-through. By the way, there is another point which I think important is the vaccination. Other vaccination, not COVID vaccination. So I think the pandemic impacted the routine immunization negatively. However, we did implement certain things here in UAE, and our vaccination rate improved. One of them is the drive-through vaccination, where the mother will not worry that she doesn't need to go to the clinic or to wait for a physician in a waiting room, and then maybe you will acquire an infection. So we have a drive-through immunization, and I think this is one of the things we've learned to do it during the pandemic.
And that's a good point. When I went for my COVID vaccine in a UK hospital, I think I caught something while I was there. So it can be a problem. So it's important to minimize that risk. Okay, I've got a couple of questions left. I think one is for Michael and the last one is for everybody. And then if we've got time, we'll try to answer the final questions from the audience. So, I mean, the UAE and most healthcare models in high-income countries really are focused on treating people once they become ill, the so-called kind of sick care model where hospitals and doctors, have the key role. Do you think that because of what's happened with COVID and everything we've learned over the last year, that the focus will shift more towards prevention and trying to keep people well, particularly that people who were unwell and had chronic diseases before COVID were much more likely to have a bad outcome if they got infected?
I think it is incredibly important issue, and we see this trend like for shifting from this sick care to the healthcare or promotion of the health and wellness already a couple of years, and I think this is like already affected even in the recent World Health Organization discussions and so on, that government should refocus a little bit, to spend so much on the healthcare and building the new hospitals, to focus more on the health promotion and somehow quality of the life. If we think about the influences of the overall health, quality of medical care, I think it is only 10%, like roughly. Right? Hereditary factors around 18-20%, environmental factors around 20%, majority is lifestyle, so it is 53%. But if we will see the investment of the governments, and we have different data from different countries, from USA for example, majority it is really to the more technology and more new advanced healthcare treating the sick patients. And I think this shift in paradigm to focusing on the health and the wellness, it is incredibly important. I see this trend also in the UAE, and I was very pleased, to hear Minister of the Health and Promotion, and he was mentioning even the change of the name of Ministry of Health to Ministry of Health and Prevention was focusing or somehow reflecting this change of thinking to the wellness and the health, promoting of the health. So I think in the UAE, there are many of the now actions by the government to refocus a little bit, reshift thinking from the treating sick patients to promote the wellness and the health. And I think it is very, very important because it is also in some way very effective costly, because healthcare is incredibly expensive, and there are many studies showing that the investment to the evidence-based prevention or health promotion is very cost effective, and it could save the money for the healthcare. So I think this is really important. Also, message from the COVID. We should be, again, not forget to be prepared. So emergency preparedness or disaster preparedness is incredibly important. I think this was also, we were lucky that we had in some way experience, for example, with the MERS in 2012. So this, there was some structure of response to some epidemic. And I think this structure, this experience from the MERS outbreak was very useful to fast response in the current pandemic. But this reshifting from the this sick care or illness care to the health and to promotion of health is very important. And I see it's a very positive trend in the UAE.
Thank you, Michael. There's a follow-up question on this from the audience asking about the UAE's stand on what's described as precision public health. I mean, precision medicine is maybe more widely known, the right medicine for the right patient at the right time. Precision public health is really an extension of that, so the right intervention for the right population at the right time. And that hasn't really been a focus for most public health interventions historically, and even in COVID, we've had to institute interventions at the whole population level generally, although not in all cases. So there's a question here that says, will that be a future focus in the development of the UAE? So maybe Dr. Nawal, would you like to comment on that?
Sure. So I think, yes, likely there are a few things we will focus more, inshallah, in the future. One is the prevention, and second is individualized medicine. Individualized medicine, it includes also prevention. And as you know, UAE, they are trying to study the UAE genome and predict what type of disease we are at risk, what we should prepare for our possibility of future disease, how we can prevent certain diseases. And I think the UAE genome will answer a lot of questions, and this is part of the government investment in having more of individualized prevention and medicine.
Thank you. I mean, I think in terms of public health, I guess I'm slightly unusual in being both a clinician as well as a public health doctor and epidemiologist, and it's not sometimes always the case that we have been very good at ensuring that our interventions are targeted as well as they could be. And I think new technologies will help with that. So the use of mobile phones to both monitor people's kind of health and measure different aspects of their health, as well as to deliver interventions through smartphones, etc., could really make a big difference to that. So we are able to deliver those interventions much more effectively than was the case previously.
Raghib, can I add something to it?
Sure.
It's very important to the healthcare. I think the health authorities should recognize that the prevention is a very important part of the healthcare, in fact. And when they are like timing, for example, physicians' visits, like family physician or something like this, they should really recognize this advice for the exercise or diet, that it should be part of the the visits. Because if it is only treating the the acute or the chronic condition and not to speak about awareness and prevention, it will affect again the health. Another issue, I think we need to reconsider a little bit of how we are educating the future physicians, that it will be not only about the clinical experience and how they treat the patient, but this embed in their mind that the promotion of the health is incredibly important part of their mission, of their work. For a researcher, I think we need to also think how this research from the population, the epidemiology and prevention, how to transfer to the health action. This transferability of the, our research to the action, sometimes it is limited. So I think this collaboration between academia and again, the health sector is incredibly important to monitor situation, but also how to transfer the research to the health action, which could be really related to the improving of the health.
Okay, thank you. The last question we had from the questions that were sent in before the session is really in relation to teaching, actually. So it's a slightly different topic, but all of us are involved in teaching, whether a university or to residents. So maybe I'll go back to Jonathan Fulton to answer this one first. So, of course, there's been a huge change this year in terms of shifting to remote learning, which had never really been the case before. So what was your own personal experience with that? And do you think that that will become more normal in the new normal post-COVID?
From a personal perspective, as a teacher, and as a parent of middle school and high school kids, I hope not, because I don't think we were really prepared for this as a profession. I know that everybody is trying to deal with it as best as they can, and it requires tremendous patience, but it also requires tremendous training. And at my university, we tried to roll out a program. It was the definition of building an airplane while it was taking off. And we didn't have resources to train faculty. We didn't have resources to train students. And I think the fact that everybody has just been thinking, well, this is a temporary situation, nobody's really committed to making this a part of their professional lives. So I expect that, so for example, at Zayed University, where I teach here in Abu Dhabi, we have classes that are segregated by gender. At the undergraduate level, at graduate level, they're mixed, but we have a lot of cases where a lot of our female students are pregnant. They've got a lot of help. They've got doctor's appointments. They've got family issues. Being able to deliver quality courses online would be great for them. So maybe that will be something that we go with going forward, is making that an option for some students or rural students. I mean, I grew up in a very rural area. Having access to quality university education for rural students would be a great thing. But again, this as an industry, as a profession, we need a massive rethink of how we do it, because I don't think we've done it very well, sadly.
I think as parents, we'd all agree that we prefer our children to be back at school, definitely.
Yes.
So we appreciate our teachers more maybe than before. Michael, would you like to comment on that in terms of your teaching experience?
Of course, this distance learning was already, we had some experience even before COVID pandemic. Mostly it was related to some the graduate courses and some workshops and so on. Sometimes we were using blended learning, but it was not in the scale how suddenly we have to transfer everything, this face-to-face teaching to the distance learning or digital learning. And I think it was really incredibly challenging, and not only from the infrastructure-wise, that everybody should be equipped with the computer and with the good, the connection, internet connection. I think, all the families experience this, especially with the kids. I think it is very challenging. But, for our educators, it is very difficult to transfer this, to recreate this teacher classroom dynamic in the digital environment. I think it's really very challenging. And I think also it was frustrating for us as teacher, and also I think for the students was really, it was lacking this social interaction. And I think this social interaction in the teaching is incredibly important. I think that there are many lessons what we can learn from this distance learning, how to, for example, use some sort of technology in improving the the teaching experience or students experience, but it will be not completely replacing. We started to even already to equip our classes for some distance communication in some ways, that the teacher, for example, could be outside the country and have the lecture to face-to-face classroom. Or some students who cannot attend, but they could connect to the classroom from distance. So we are trying to use a little bit this experience. But in the pedagogy, I think it is, again, very important to think about this, how this cognitive neuroscience could be applied for the learning. And I think this was really, again, not thought through, that we cannot really transfer exactly the experience from the face-to-face to this digital learning. And I think the lessons we should learn how to enhance somehow this experience using some technology, in the flipped classroom or whatever, but we need to think about. I think that it can be not completely replaced. The digital learning, it is clear now that it is not replacing completely face-to-face learning and group activities. And this, I think social peer interaction is incredibly important for the experience of the educator's experience.
Yes, Dr. Nawal, would you like to add anything to that?
I think distant learning, it has a lot of advantage. We cannot deny that, but at the same time, there is very important for certain things like face-to-face learning, interaction, social interaction, exercise, lots of things children cannot do it. And as soon actually as they allow school children to go back to school, I let my son to go back to school, and he is very happy. He felt that he cannot really learn much by distance learning. Distant learning, I think it's even more difficult because it needs a lot of focus, and I don't think it is that useful for young children, maybe for the older children, but young children it will be very difficult. And however, I think at some point we have to do distant learning at the beginning of the pandemic. And now with the vaccination, most of children hopefully will be able to go back to school.
Thank you.
Can I just jump in with?
Also, I think that from the parents' perspective, for the parents, it was incredibly important experience, because now the parents are appreciating even the role of the teachers and the school. Suddenly, they started to, to be teachers in some way, right, of their own kids, and they realized how important it is, the school system and the schools, for the education of the kids. So I think this experience was also quite important to appreciate what the educational system is doing for the kids.
Definitely. Jonathan, you wanted to come in as well?
Yeah, just so this is a student conference. So in case there are any undergraduates who are still listening at this point, one thing I've noticed is that this is the third consecutive semester of teaching this cohort of students in my program, in my international studies program. This is 3 consecutive semesters of not seeing any of my students face to face, which is unusual because it's a small program and we get to know our students very well. So what's been happening is a lot of students, they log in, they maybe haven't done their hair, maybe they're still in their pajamas or whatever, but they're not turning on those cameras, they're not meeting us outside of class. And just as a practical tip for you students who might be listening, you got to find some way to distinguish yourself to your profs when you're working online, because we don't know you the way we normally do. And I've got students who are asking me for like reference letters for grad school. And I say, I don't know you. I don't know anything about you. I can look at the grades on my grade center on Blackboard, but everybody's grades are very unusual right now because there's many
all of them A's.
Yeah, there's a lot of A's right now. So, really, for just a pro tip for you students who might be listening, find some way to connect with your profs because we don't know you. It's one of the joys of our lives as teachers is getting to know our students. And when that's gone from our lives, it makes our job a lot less fun too. But on a practical level for you, you're going to want us to remember you. So find some way during COVID to reach out to your profs and find some way to get to know us or get us to know you, more importantly.
Thank you. That was very important advice, John. Thank you. I'm going to maybe spend 2 minutes just to answer these questions on the chat, which I think I'll probably address most of them myself, and then I'll come back to the panel for any final points that they'd like to make before we finish. So we've got kind of 4 related questions about travel for people that come to the UAE from outside, and I've done this a couple of times myself over the last year, which maybe others haven't. So the system, it depends where you land. So if you land in Dubai, the rules are somewhat different if you land in Abu Dhabi. If you land in Abu Dhabi and stay in Abu Dhabi, you will have to follow, of course, the rules of Abu Dhabi, which can include quarantine or does include quarantine. Well, the rules are slightly different now, depending which country you come from. So there's a green list of countries where you don't have to quarantine, and other countries where you do. And if you're vaccinated, also the rules are slightly different. I'd advise you to look online. All this information is available online. Testing is easily available in the UAE, as Dr. Nawal mentioned. We have one of the highest rates of testing in the world. So it's very easy to be tested, not just in hospitals, but in many places. You don't have to worry about getting tested. Travel, someone's asked about travel bubbles, or usually called travel corridors. That's really the concept of the green countries. So if you're in a green country, then you can travel freely. The rules regarding how vaccines will affect that still haven't been agreed internationally. So different countries have their own rules. So that we'll have to wait and see. It says, will the UAE and China be part of it? Of course, there's already a bilateral travel arrangement between the UAE and China, but that will possibly change as international rules come in. So we'll have to wait and see. The final question, which I'm not going to be able to give an answer for, but just to make sure you don't think it's been ignored, it says, why does Abu Dhabi and Dubai have different levels of restrictions against COVID? There are some differences, although they're all part of a federal structure as well to control COVID. And the governments, of course, of the different emirates work together closely to ensure control of COVID. But I don't know if Dr. Nawal wants to comment on that.
Well, UAE, it's consists of 7 emirates, and there's a lot of things done at the federal level. But again, it's up to the state or the emirate to decide on certain things. So there are certain things, it's based on the emirates, and it's up to the emirates of doing things. I'll give you an example. It's like United States. There have many states, and the rules vary between New York to Florida to California, and more or less here's the same. There are things where everyone follow by at the national level, but in terms of restriction with testing, there is a difference between Abu Dhabi and other emirates. And actually, there is also difference between Dubai and other emirates, not only between Dubai and Abu Dhabi.
Thank you. So we're about to finish now. I'll just ask our panelists maybe if they have any final comments for about a minute before we wrap up. So any final comments anyone would like to make?
Actually, the pandemic, I'd like to remind everyone, the only way to end the pandemic is to work all together globally.
That's a very good and concise point. Thank you. Michael, would you like to add anything?
I agree that we, in the health, we should be not so selfish. We need to take care about ourselves, about our families, but every time we need to think also about the community and, even our neighbors. I think it's very important what Dr. Nawal was mentioning. I agree with this. And I would like to thank for this opportunity. I think it was really excellent. I enjoyed the discussion, and thank you for the invitation. It was very interesting.
Jonathan?
I think they both articulated a great point to close on, and thanks for inviting me here today. A really interesting conversation, and yeah, thank you.
Great. Well, thank you again to our 3 distinguished speakers. I hope you've all learned as much as I have over the last hour and 15 minutes. Thank you to our audience for joining us from, I know it's very late in China particularly, and we really appreciate your time, and we'll hope to see you again at the next China Gulf Forum. So thank you to everybody.
Thank you.
Bye-bye.
Bye-bye.
Thank you so much to our panelists and moderator for this fruitful discussion on public health, international relations, and interesting education.